All right, Dr. Tony Rhodes here with another episode. And today we're going to talk about headaches. So this is something that I have found over the years that a lot of chiropractic patients really don't know that chiropractors can help with headaches. And or just the general population I found doesn't know that chiropractors can help with headaches. We've had lots of acquaintances that have never been to a chiropractor, family, friends, and somehow it'll come up into a conversation and they'll say, "Oh, wow, I had no idea that chiropractors could help out with headaches." And um, so today I want to talk about that and just discuss, what types of headaches and causes that we can help out with, because 40% of the population deals with headaches off and on. So it affects a lot of people. And I found in my experience of 14 years of being in the industry that it's almost an afterthought of patients that come in with, most people know chiropractors can help with neck pain, back pain, sciatica. And it's almost an afterthought of, I'll ask them, yeah, any headaches with your neck pain? And it surprises me still to this day that a lot of folks will say, yeah, I do have headaches. Is that something you can help out with? And I'll ask them more about it. Tell me, how often do you get these? Well, about every other day. And sometimes it's like every day. And I'll ask them how long you've had these. Oh, about 10 years. And I'm just shocked that, you know, um, it's not at the forefront of their minds to tell me about this. But it just makes me realize that a lot of people don't know. And I think the other thing is a lot of people just don't know um, that their neck and the mechanics of their neck could be the source of their headaches, because there are a lot of different sources of headaches. There's so many factors that go into it. A lot of times it can be due to dehydration. It can be due to the foods that someone's eating. It could be stress. So there's a lot of other lifestyle factors that could play into this. And the other thing as well is it can be due to, their mechanics being off in their neck, but it could be 25% due to stress, 25% due to lack of sleep. And so it doesn't have to be just from one source. It could be all these things adding up to just these horrible headaches. I just had a patient about a month ago that came in referred by her sister, and she had been dealing. She's mid 20s, just had her first baby, and taking care of her baby, and that's a lot of work, and like a lot of moms just put herself on the last, as far as to take care of. And so finally her sister said, you need to go, made her appointment, and she'd been dealing with headaches for about a decade, and we're a month in, and now she's down to one or two very mild headaches. They're like 75% improved. And she just had no idea that we could help out with that. And so and again, not all headaches can chiropractors fix. There are some related to other factors. There's hormonal things. There are post-traumatic headaches that maybe are due to a brain bleed, from big car accidents and things like that, or just, head injuries from sports. And obviously that's a whole different treatment. But for headaches that seem to just have gradually come on, and that seem to be related to, let's say, posture, that's a clue when someone tells me that their headaches get worse at work when they're on the computer. So yeah, posture related is a huge thing. So I'll kind of back up a little bit here. So one thing that's important is obviously to get a full workup. And like I said, not all headaches can we help with, but I would say a lot of biomechanical, cervicogenic, they call it the medical community, meaning it's stemming from the muscles, the joints, and the neck we can help with. And obviously that starts with a good history, exam, and it does surprise me too that a lot of folks have had zero imaging, so no MRIs, no CTs, no X-rays, and they're going on 10 years of having these headaches. So many times it's starting off with, good history, good exam, getting some imaging. And I'm finding that younger and younger people are having, these headaches and reverse neck curves. So I would say 9 times out of 10, that's what I'm finding in practice is their neck curve is totally reversed. So I'm not sure if we can potentially pop up an image here on some of our video content, but your neck has a natural, they call it lordosis, and I call it a banana-shaped curve. So you should have this nice banana-shaped curve in your neck, and like visualize a banana or a bow and arrow. You should have that nice curve in your neck, but over time, with working at a computer, poor posture, a bad pillow, sleeping on the couch, the curve in the neck will reverse. And that will cause a lot of tension and stress on the muscles, the joints, the nerves, and start causing headaches. So we'll do a history, we'll do an exam, we'll do a full workup. And many times we're finding these totally reversed necks. And it takes time to, change the body naturally. But once we have identified the issue, and 9 times out of 10, that is it. And it does, along with a reverse neck curve, the muscles get in an abnormal position. There's trigger points, muscle spasms. And so many times it's the joints that need moved and get and put in the right spot. And then also their muscles need worked on. And so for many people, they'll ask, do I need chiropractic or massage? And many times I'll tell them you need both. And it's like a good dentist asking them, hey, should I brush or floss? Well, you need both actually for superior results. So many times we're putting people on a treatment plan where they're getting chiropractic adjustments, they're getting massages as well. And if we see that reverse neck curve, we're also getting them on a really nice pillow that's going to give them this arch support, kind of like a lot of people will talk about their foot needing arch support. Your neck needs that natural or needs that support to get your neck to the way it naturally should be. And the more we're at computers, the more we're looking at our phones, the more our neck is looking down and the neck is going to reverse. And oftentimes I'll tell people your head is almost the same weight as a bowling ball. And if I told you, grab this bowling ball in your hand and hold it out in front of you, how long would it take before your muscles, your forearm just is on fire and you're like, I cannot hold this anymore. I mean, that is what you're doing to your neck, your upper back, and that will trigger headaches. So part of our strategy is getting the head over the center of the body, getting that stress off the joints, the nerves, the muscles, and getting somebody on a good pillow. Sometimes even just being on the right pillow can reduce neck pain and headaches by 50%. So, and to me, investing in a good bed, in a good pillow is money well spent. If we're willing to spend $30, $40, $50,000 on a car, we should be willing to spend a tenth of that on something we are spending a third of our life on a day. So if you think about that, you sleep a good 8 hours a day, a third of your life is spent sleeping. And on that bed, on that pillow, man, it is money well spent to get a good mattress, get a good pillow, because that will support, maintain a lot of what we do here at the clinic. And that's what we talk a lot about. And it's a big inspiration behind the podcast is how can we give people tools to help themselves and heal themselves outside of what we're doing here and to maintain those improvements that we can give them. And so I'm often pointing them to, pillows that we have or just great mattresses as well. And yeah, it's just, I don't know what it is, but a lot of people are hesitant to spend that money on a good mattress. But I tell them, if you're not spending at least 1,000 to 2,000 on a good mattress, you're probably not getting a good one. And a good pillow, you're going to spend 100, $200. But again, it's money well spent on your health and just to feel better. So, so again, that is part of the strategy of what we do to correct headaches. And it's something to potentially ask yourself, or, if you're thinking of someone that has these horrendous headaches, is how are they sleeping? Do they have a good pillow? Do they have a good mattress? Those are questions to ask. And then, many folks that have gone to their PCP, their primary, they've had maybe an MRI, they've had different imaging, nothing's showing up. They've tried various medications, nothing's working. That is often when someone comes in, or we'll just discover it through history. Try to get rid of these headaches for good, or at least minimize them to where maybe they're 90% improved and going from a headache every day to one a week. A lot of people that come in are like, geez, even if you could reduce it by 30, 40%, that would be amazing. So, yeah, it is fun to work with people that have no idea about this, and we're able to give them that relief. And for the mom I was talking about earlier, she's just, more present. And when you're in pain, it's hard to have PTC, present time consciousness, with your family, with people, and just to be focused on your day, the people in front of you. So those are some of the big things. I do have other patients that also do Botox. And when you hear that word, most people, I think, gravitate to cosmetic, and aesthetic medicine, where that also can be something used in conjunction with chiropractic. I've had patients do that, and they've had, good results as well, because Botox basically paralyzes the muscle, causes it to relax. And once those muscles are relaxed, we can get in there easier, start adjusting their spines. And so, that would be for extreme cases, but that can help. And many times we are getting people off of medications. There are many, many cases where someone is on, gabapentin or just various headache medicines, and a month, two later, they're like, wow, I just don't even need these anymore. Not that we're prescribing or taking them off of them. They just, tell us that, or they're going to their doctor saying that my headaches are gone. I don't need these anymore. And so that is amazing and awesome to, because there's obviously side effects to the over-the-counters, to some of the meds that people are on. So that's great to see that, they don't need those anymore. Another question that can come up is chiropractic safe? Yes. And I think one of the biggest things here is making sure you have a proper history, proper diagnosis, proper imaging to know if this is the right fit for you, if it's safe, to rule out red flags so we can minimize the potential side effects from chiropractic. But in general, chiropractic adjustments, massages are very safe. And it is also another issue that comes up where people ask us, is it safe, and is it fine for kids and teenagers? And absolutely. They're, like I said, the more and more as time goes on, and the more technology and phones that we have, the more we're seeing it in younger kids having headaches, neck pain. So especially with just all the social media, it's crazy walking out into our lobby. Sometimes I'm like, this is why people are having these neck pain and headaches. They're on their phones looking down, and those neck curves are getting reversed. So hopefully this sheds some light on the fact that, yes, chiropractors can definitely help with headaches. And if you're someone that is, curious and wondering if you are a candidate, or, if a family member or friend could get relief from their headaches with chiropractic, I would um, encourage you to send this episode to them. And if they want, call their local chiropractor if they're not in our area. We serve the greater Portland metro. We're in Tigard, Oregon, and this is what we do on a daily basis. We have on-site x-rays to, do x-rays. Sometimes CT scans, MRIs are needed. We got to refer out for that. But 9 times out of 10, we can figure it out with a good history exam and x-rays. And this is something that we're treating on a daily basis and typically get very good results with. So hopefully that helps, just gaining an understanding of how chiropractic can help out with headaches. So if you have more questions, send us a message on social media or give us a call, and we would love to help. So until next time, take care.